Hi, my name is Jenny De Jesus. I'm a registered nurse and certified diabetes educator. If you or a loved one has diabetes and has been prescribed insulin, there are several things you should be aware of. To begin, many types of insulin are available. Your healthcare provider will decide the best type, amount, and administration times for you. It is important to know the ways in which insulin may be injected and which parts of the body are potential injection sites. And it's understandable if you're nervous or anxious about injecting insulin. Although injecting insulin might feel awkward or scary at first, with a little practice you'll discover it only takes a few seconds. To help ease your anxiety, I'm going to show you how. Let's get started. There are three primary tools used to inject insulin. They are insulin syringes, insulin pens, and insulin pumps. There are four areas of the body in which insulin can be injected. They are the abdominal area, some parts of your arms, some parts of your legs, and certain areas of your buttocks. The preferred injection site is the abdomen, specifically from the bottom of the ribs to the pubic line, avoiding the navel. The abdomen provides the best absorption and is relatively easy to reach. Avoid areas with scarring or moles because tough tissue may not absorb insulin well. If your healthcare provider has prescribed insulin for you to use using a syringe and vial, follow these 5 steps. Step 1. Roll your insulin if necessary. If using an intermediate or long-acting insulin that looks cloudy or milky white, gently roll the bottle between your palms for 15 seconds to mix. Only the cloudy-looking insulin needs to be rolled. Step 2. Measure air. Measure air into the syringe by pulling the plunger back. Match the black plunger with the correct marking on the syringe. Step 3. Equalize the pressure. Remove the cap from the top of the insulin vial, revealing the rubber stopper. Remove the needle cover. Put the needle through the rubber stopper and push down on the plunger to put the air into the vial. This helps equalize the pressure in the bottle, making it easier to withdraw the insulin. Step 4. Prepare your dose. Leaving the needle in place, turn the bottle upside down. The needle tip should be fully submerged in the insulin. Pull the plunger down to measure your dose, again using the black tip of the plunger to match the markings on the syringe. Pull the needle out of the vial. Gently tap on the syringe to move any air bubbles up. Slowly push the plunger so that the air exits the syringe. Step 5. Inject your insulin in the appropriate injection site. To inject yourself, hold the syringe like a pencil. Gently pinch the skin with your free hand and quickly insert the needle at a 90-degree angle. Release the pinch. Push down on the plunger in a steady motion until the syringe is empty. Pull the needle straight out of the skin. That's it. As I mentioned earlier, with a little practice, you'll be able to inject yourself in a matter of seconds. If your healthcare provider has prescribed insulin for you to inject using an insulin pen, follow these 4 steps. Step 1. Choose injection site. Regardless of whether you're injecting insulin via a syringe or the pen, select a different injection site each time you inject. Step 2. Prime the pen. Insert the needle into your insulin pen, turn the knob to the number 2, and press down on the knob to prime the pen. Step 3. Set the pen to your dose. Turn the knob until you see the correct dosage. Step 4. Inject yourself. To inject yourself, hold the insulin pen like you would any other pen. Gently pinch the skin with your free hand and quickly insert the needle at a 90-degree angle. Release the pinch. Push down on the plunger in a steady motion until the pen goes back to 0. Pull the needle straight out of the skin. If, however, your healthcare provider has recommended and prescribed you inject insulin using an insulin pump, you will go through additional training on the use of the device. Thanks so much for watching. For more health and wellness information, visit healthywomen.org.